Dr. Howard Manyonga joins us via our video link this morning. Doc, it's great to have you with us on the program. Thanks very much for coming on. The connection between this lack of birth control, can we make that link between the lack of birth control on the one hand and this increase that we've seen in teenage pregnancies?
Yeah, absolutely. It's one of the factors. So this is a condition which has many factors contributing to it. Yeah. But certainly easy access to contraception is a huge contributor as a factor to adding up to teenage pregnancies.
It's an issue that's reflected as well in a number of newspaper articles this morning. The issue of a lack of condoms, not only at clinics and healthcare centers, but at venues like, for example, truck stops. There's the issue in Mpumalanga that's being highlighted this morning. For 2 months, the entire province of Mpumalanga faced a free condom shortage due to supplier stockouts. What do you know about this shortage, Doc?
Well, I don't know anything specifically about that Mpumalanga case. However, in general, I think it is fair to say that the constraints on the healthcare system are well described and well known. If you look at reports like from the Health Systems Trust and many other credible organizations, District Health Survey, etc., they all show that there are chronic problems in healthcare, which would include, of course, shortage of commodities, and condoms are not excluded from those shortages, and there would be differences between the provinces. So some provinces are worse than others, and I guess we can go into the reasons what's behind it, but these are not new problems. It just waxes and wanes, I guess. Yeah. So not surprised at all.
Not surprised, but it is potentially a disaster.
Absolutely. I think the impact of a teenage pregnancy, which WHO defines as any pregnancy under the age of 20, so particularly looking at that adolescent group, the impact is really multi-generational. So we not only think of the child whose life has been disrupted, but also the child who's born. They are born into very difficult circumstances. And what we know about teenage pregnancy is that it is a condition that's closely related to social adversity. So the social determinants of healthcare interact with this teenage pregnancy. So to a large extent, it is an indicator or a marker of the quality of the healthcare system that we have. And I think that there is a shortage of condoms and the other commodities and the healthcare staff that is under pressure. These are all symptoms of an underlying problem that requires a rethink in how we deliver healthcare in this country.
It's, of course, the worrying issue of teenage pregnancy, and as you say, this generational impact, not only on the child that is now having a child, but on this baby that has been born. So that's on the one hand, Doc. And then on the other side of this, given the lack of access to contraceptives, including condoms, it also means a rise in things like STIs and HIV. The issue that I mentioned to you in Mpumalanga, for example, this newspaper article cites one truck stop where a nearby clinic says there's been a spike in cases of STIs.
Yeah, absolutely. So when you think of it in public health terms, I think you can agree with me that there are certain occupations that are higher risk than the average, and the trucking industry has been well known and indeed identified as a special or a key population that requires special attention, particularly because of their mobility and generally their difficulties in accessing healthcare facilities. And you would know, of course, that this is, again, a common cause, that there is debate about the participation of foreigners in this industry. And with previous conversations around foreigners and accessing primary health care, etc., you can imagine how disastrous it is for a track center, which may be the only source of health care and a source of this kind of commodity, to not have it. And the ripple effect, of course, will be felt in all the domains in which these trackers exist. So with their families, but also just based on statistics, the probability of their interactions with commercial sex workers, etc. So the combination of not accessing condoms in an industry which is already at high risk of communicable diseases, I think is quite disastrous.
Yeah.
And
sex workers themselves, even though according to healthcare workers, would prefer to use condoms, if there is a case where there is a shortage, at least according to some of the information that I have here, sex work still goes ahead, even outside of a shortage like this one.
Yeah, absolutely. I think that is well known again, that you will recall that it was a huge effort on the part of non-governmental organizations and other CBOs to persuade the commercial sex industry into adopting condoms as a standard equipment. And that has now since been well established. And I guess we cannot also deny that the activity will carry on with or without condoms, because the reality is people have to put food on the table, and the absence of condoms is not going to stop them from carrying on with their trade. So certainly our duty as a healthcare system is to make sure that every loophole is closed, that there's a buffer supplies and etc. and so on and so forth, to make sure that there's a smooth and uninterrupted supply of these commodities, which are life-saving. And that has to be combined with access to primary care services to treat the conditions that are sexually transmitted. Certainly. So I guess this is never going to be the supply of condoms is going to solve the problem. It's going to be a multi-pointed approach where you have to look at supply of people, the professionals who offer the services, the hours of operation of that service, understanding that the preferences and the work patterns of some of these high-risk or key populations requires us to have extended hours, which is not always a common thing in the public sector. Yeah. So there are all those challenges which altogether require not just a piecemeal approach to isolating condom supply, but to say, let's take a step back. What are the things that we must address so that next year we don't have the same headline? Because this is not a new headline. It happens every year. It's almost predictable that at some point there will be a headline from one of the provinces about shortages like condoms and other basic commodities. Yeah.
Even the headline around teenage pregnancies as well. We see that every year as well. But Dr. Manyonga, let me thank you for your time this morning. Thank you for giving us that very important perspective. Yes, this shortage of condoms around the country, important as it is, it's one part of a much bigger puzzle. Dr. Howard Manyonga is an obstetrician and a gynecologist.